Okay, the meninges, they cover and protect the central nervous system. They protect blood vessels. They contain the cerebrospinal fluid, right? That clear fluid that goes floating around through the ventricles in your brain and up and down around your spinal cord and such, right? And they partition the skull, right? Walls inside a building are called partitions sometimes, right? Yes? I bought my office. It was the front part of it was a big open building, and then I drew a plan, and the guy put the partitions up, right? To make the individual rooms where I wanted. Yes? Okay? Now, the outer layer is the dura mater, or some say mater, right? Dura mater, right? That means literally tough mother. That's what dura mater means, tough mother. We get the same word durable or durability, right? That's what it means, yes? Okay? It's 2 layers, the outer being fibrous, 2 sheets of fibrous connective tissue, right? Below that, we have the arachnoid, yes? A-R-A-C-H-N-O-I-D, arachnoid. Mater, nobody ever says mater, they just say arachnoid. Oh, by the way, what is arachnophobia? Fear of what?
Spiders.
Spiders, right? Yes. So that arachnoid layer, it has little protein projections that tie it to the upper and the lower layer. And they thought it looked like spider web, so that's where that comes from, arachnoid, right? Yes? And oh, by the way, the arachnoid, above it, you have fluid, right? Below the dura, above the arachnoid, that's subdural. And then below it, you also have that fluid, that's subarachnoid, right? Yes? Hit your head, boom. He has a subdural hematoma below the dura, right? Or subarachnoid, yes? Now drill a hole in your skull and relieve the pressure, okay? So the arachnoid is the second layer. It is a loose covering separated by a serous cavity. We just talked about that. That's CSF floating around. And the CSF comes from that 4th ventricle. Remember we said there are apertures, which are holes, right? Yes, and such. And then the innermost layer is called the pia mater, right? And that literally means tender mother, okay? It is a layer that wraps your brain kind of tightly. You know, you buy things that are wrapped up tight in saran wrap, right? It's very tight, it's not wrinkled, it's like shrink wrapped, right? Think pia mater, okay? Yes? In the Vatican, there's a famous Leonardo sculpture, and it's Mary, and she's holding her hands like that. She's holding Jesus in her hands. It's called the Pieta, right? And it's amazing to go see. Only they got a big piece of plastic because in the 70s, when I was a kid, some crazy German ran up there with a hammer and tried to bust it up, and that's a true story. But anyway, so it's behind glass now when you try to take your picture. Yes. But anyway, the Pia Mater, right? And evidently in Mexico, they're making a dozen reproductions. And one of them's going to be here. I was talking to a man today, and a Catholic man today, and he said, I think it's going to be here in the Amarillo area, right? Meningitis, inflammation of the meninges. These are the meninges, right? M-E-N-E-N-G-E-S, the meninges, yes? Okay. It can be bacterial, it can be viral. And I know I've asked this question before. Who generally nowadays are the ones who gets meningitis? Young college students. They go to college, they're living in the dorm, there's a bunch of other young students. That's why a lot of colleges require that you have a meningitis shot before you go to college, right? Now, encephalitis, okay? Meningitis, encephalitis, right? Inflammation of the brain, that's inflammation of the brain. Itis means inflammation of, right? So, Encephalitis is inflammation of the brain. Now, many times meningitis spreads and it becomes inflammation of the brain if it's not treated quickly. But anyway, encephalitis, yes? You can get bit by a mosquito that carries St. Louis encephalitis in Houston, where I grew up, right? So you don't really want to get mosquito bit in Houston, right? Okay, the cerebrospinal fluid. Cerebrospinal fluid, CEREBROSPINALFLUID, CSF from now on. The CSF. We make maybe about 150 mils every 8 hours. And in another spot, the book says about 500 mils a day, right? So 450 times 3 is 450, 500 in a day, somewhere along in there, 450, 500 mils of CSF. Cerebrospinal fluid comes from the blood. That's where we make it. And it has some protein in it, okay? Has some protein in it, yes? And we talked about how above and below the arachnoid layer, the brain is floating. And that floating takes the weight off of the brain so it's not compressed on itself, okay? The CSF is a watery broth similar to blood plasma. Blood plasma is mainly water, but it's got protein and some other things in it, right? Now, you remember we talked about there's a ventricle here, one down here. Yes, there are 1, 2, 3, 4 ventricles, right? Yes. And the roof of these ventricles, right? The ependymal, the glial cells called ependymal, EPENDYMAL, ependymal cells make CSF, right? The ependymal cells, they make the CSF, right? And the roof of the ventricles, okay? Remember they're glial cells, right? Glial cells is neurologic cells, but they're not neurons, okay? They're not neurons, yes? Okay, now, pardon me one thing. Okay, in the arachnoid layer, there are little openings, right, called arachnoid villi, right? Remember in your gut, you also have villi, little things that stick out and such, and they're vents, basically, okay? The reason I mention that is because the next thing we're going to talk about is hydrocephalus, H-Y-D-R-O. What's hydro mean?
Water.
Water. So what does hydrocephalus mean? This is cephalic. Water on the brain, right? Water on the brain. So there are some babies that are born. Remember, when we're born, our skull's not all formed yet. It's not all bone yet, right? We've got the anterior and the posterior fontanelles, right? And so what happens is there are some children that are born and they have a defect to this system. And the CSF, remember, you're making about 500 mils a day in an adult. But anyway, you're making it, but it's not getting drained off, right? And so what happens is the baby's skull swells because the pressure, right? And in years gone by when this happened, the baby's head looked like an alien and he died young because it squeezed on his brain, right? But it's simple to fix now, thanks to the neurologists, the pediatric neurosurgeons. What they do is they put a shunt. A shunt is a fancy word for a tube. And it goes from in one of the ventricles, I assume that's where it goes, down, and it drains into the abdomen. Remember the abdomen? Remember the serous membrane, the serosa, right? Yes, peritoneum. It drains down into the peritoneum where it's just absorbed. So when the pressure gets too high, so the baby's skull does not get huge, right? But there's a picture in the book on figure 12.25. You can see a baby with hydrocephalus, okay? Figure 1225, okay? Now, incidentally, many years ago I had an older gentleman in his mid-70s in my office, and he came in, I'm visiting here in Dalhart, and he says, I want you to give me a treatment on my neck and this and that. So I checked him this and that. Okay. And so I have him laying on his back and I'm palpating his neck, right? When you feel stuff, that's palpation, whether it's the abdomen or whatever, right? I'm palpating his neck and this is weird. And finally he goes, oh, I forgot to tell you. He said, do you know what San Joaquin fever is? I said, oh yes, valley fever, yes. Q fever. He said, I had that, I have a shunt. He had the tube, and the tube ran from up in here, down the back of his neck right here, and around, and down into his abdomen, and I was feeling the tube, and I knew, that's weird, something's not right with that. And I forgot to tell you. And I'm like, well, have you been to the chiropractor since you got that shunt? Oh yes, many times, don't worry, you're not gonna hurt me. So I worked him over, right? But he had the tube right there. I was feeling the tube. I was feeling his bones. And I'm like, what is that? Because it was a little bitty tube. It was a little bitty plastic tube coming out right here and coming down, right? And they fed it down and through into there. But I'm feeling it from there to there. So it was anyway, he was impressed I knew what valley fever is. Valley fever is Southern California, the desert, the San Joaquin Valley. There's a fungus. And if the dirt gets stirred up and you breathe it, you can get that fungus and you can get valley fever or San Joaquin Valley fever or Q fever, or let me think, there's another name. I'll think of it in a minute. But anyway, here the doctors have never seen it, but it's very common there in Southern California in that desert area. Okay? Now, let's talk about the blood-brain barrier, right? Have you heard that before? The blood-brain barrier, right? Well, what in the heck is that? That basically means this. The capillaries in our brain, okay? The capillaries in our brain are the least, they're the hardest to get things through, okay? Remember we talked about, I think it was chapter 1, tight junctions, where cells are hooked together in certain areas with tight junctions. It's kind of like Velcro, and they're stuck together very tight, so it doesn't pull apart. Well, in the endothelium, the inside, the inner layer is called the endothelium, right? And the endothelium of those capillaries are very tight, and the lamina propria, the next connective tissue around it, is very thick, and basically it's harder to get things across that, okay? Now, that keeps certain things out of your brain, okay? But I need you to get this, okay? The least permeable, that's the word I could not think about. They're the least permeable capillaries in the body, okay? And what that does is it keeps certain things out of your brain, okay? But the blood-brain barrier is selective, not absolute. And what in the heck does that mean, right? Remember we talked about the outer part of the cell membrane, right? It's phospholipids, right? Phospholipids, yes. And cholesterol, they're fat, they're lipids, yes. Well, guess what? Fat dissolves in fat. Oil and water don't mix, but fat will mix with fat, okay? Liquid, okay? And so what happens is cholesterol, fatty molecules will go right straight through the blood-brain barrier, no problem. Fat-based, lipid-based, cholesterol-based hormones go right straight through it. Oh, by the way, alcohol, right? Straight through it, no problem. Yes? Oh, by the way, nicotine, straight through the blood-brain barrier, right? Now, there are some medications that don't cross the blood-brain barrier, that don't get through. But if it's fat soluble, if it's nicotine, alcohol, let's see what else. Fats, fatty acids, oh yeah, oxygen and CO2, very important to switch, right? Okay. Alcohol, nicotine, and anesthetics, anesthesia, right? It'll go right straight through the blood-brain barrier and knock you out, okay? Okay. Let's talk just a little bit about traumatic brain injuries, okay? Traumatic brain injuries. Now, every couple of years they change the name of these, and years ago it was traumatic brain injuries, TBI, okay, and such. But let's talk about head injuries basically, right? Head injuries are the leading cause of accidental death in North America. Yes? Right? Who has head injuries most commonly? Which type of people? Of which I'm one. That's a very good guess. Motorcycle riders, right? Donor cycles. That's what they say. Ooh, you ride a donor cycle? No, I don't. Right? Yes? But if you notice, I always wear my helmet because when I was young, I hit my head on the ground many times. Some people think that's what's the matter with me now, but anyway, it's very common to hit your head on the ground, right? Yes. That's why it bothers me when I see people not riding them. Now you will see me, I will ride my bike down to the end of the driveway, make a U-turn and pull it back in the garage when I'm turning it around. That's about the only time you'll ever see me without a motorcycle helmet on, because I'm going 2 miles an hour and just turning the bike around. But other than that, I have one on. I believe in them. Right? I just do, okay? So, head injuries, right? Let's talk about concussion. Yes, a concussion. C-O-N-C-U-S-S-I-O-N, right? Concussions, right? It's an alteration in brain function. It's usually temporary, following a blow to the head. What are the signs and symptoms? Somebody who's having a concussion.
Either slower, dilated pupils.
Dilated pupils, maybe. Okay, what else?
Confusion.
Confusion, very good. Yeah, they run out there on the football field and they say, what's your name? What's today's day? Right? What's today's date? Or what day of the week is it, right? Because they want to know if they're lucid. Yes? Right? Okay. Very common to vomit. Right? A good friend of mine playing football, street football. I went to college with him out in the street when he was a kid. Yes? And he fell back, hit his head on the asphalt. Immediately knocked him out for a minute or two. Woke up, started throwing up, dizzy vision, black spots, right? Spent the night in the hospital, okay? Concussions, yes? Okay, nowadays, they're making a big deal about the football players, right? Having head injuries, yes? They say in one of the Super Bowls, Dallas was in it and Troy Aikman got a concussion right at the end. In fact, Aikman had 4 or 5 of them, right? And they say that at the end, Aikman got taken out and taken to the hospital because he had a concussion. But Dallas was winning and they won the game, and they say that he would kind of wake up and become more conscious, and his best friend was his attorney, right? And he would ask his attorney, did we win? Did we win? He said, yes, Troy, you won the Super Bowl. The score was such and such, such. And I guess he asked 8 or 10 times, did we win? Did we win the Super Bowl? Right? The problem is they're cumulative, yes? Now, years ago, by the way, in the 1800s and 1900s, it was very common. The coal miners in England would have boxing teams, right? And this coal mine, their boxing team would fight the guys from this other coal mine boxing team, right? And the British doctors wrote about a syndrome called dementia pugilistica. right? Dementia pugilistica. What is a pugilist, by the way? A pugilist is a boxer, a fighter, right? Okay? So even in the late 1800s, early 1900s, the British doctor knew, right? This guy got his bell rang too many times. And they would develop Parkinson-like symptoms, right? Who's a famous boxer, former world champion, that has Parkinson's? Float like a butterfly, sting like a bee. I am the greatest. Yeah. Right? Ali, right? Ali shuffle. Jump rope, right? Real fast. Ali shuffle. Right? It's one of the deals I do, right? The Ali shuffle. But anyway, right? So that doesn't surprise me. Yes? Yes? But anyway, they're cumulative. So it's scary. If a lot of that gets out, then football will go away because no woman wants her little boy to have his brain banged a bunch of times and end up like Muhammad Ali. Shaken. Yes? Okay? Okay. Brain contusion. A brain contusion is more serious, and many times it affects the brain stem. Okay? Right? And what they're talking about now is CTE. You don't have to write this down. It's not in the book, so I won't ask a question about it. But CTE, chronic traumatic encephalopathy, right? They made a movie about it, The Black Doctor, and yada yada yada. That found that. I think they need to do a lot more research on that because I don't know, but I do know that way back in the late 1800s, the British doctor knew you get hit in the head too many times, that's not good. What about people that are in car wrecks and have the whiplash or have their head hit? Or people that get hit by a train? Have you ever known someone that got hit by a train and their brain was never the same? Or I knew a guy years ago, the truck tires, the rim was in three pieces, a middle piece, one on this side, one on that side. And when you were blowing them up, they could explode, and it exploded and hit him right here. He was never the same, right? Basically, it turned him into kind of like a smart as a junior high kid instead of a grown adult and such. But anyway, okay? Blow to the head can cause a subdural or subarachnoid hemorrhage, right? And again, they have to open your skull up, stop the bleeding, or at least, many times the bleeding will stop on its own, but they drill a hole to relieve the pressure, okay? Now, many times people who have a traumatic brain injury, what happens is that, and I'm going to tell you the story about that. Anybody heard of Liam Neeson? You know who that is, the British actor, right? And his wife, I think it was New Mexico, I think, not Colorado. Yeah, she fell skiing, hit her head on a rock, right? Got up, I'm okay, and skied on. And a couple hours later told her friends, I don't really feel that great. I'm going back to the hotel room, right? And so that night they called her room. She didn't answer. So they got the people to let her in the room, and there she was, unconscious. And you see, your brain can swell. And especially that lower part, right? We talked about in the medulla and such, where you have all these centers that control breathing, heart rate, all of that. And if the brain swells, remember that big hole, the foramen magnum, right? If that brain stem gets squeezed on that, yes, way bad, folks, and you can die. And many times these people, initially they're, yeah, I'm okay, I'm fine, yeah, and then after a couple hours, no, I don't feel so good. So if you ever have a family member that has a head injury or bang their head, you better watch them. You better watch them over the next couple of hours, especially children. I don't know. Do you have children, Selena? Not yet? No, you're too young. Okay. All right. Cerebral edema, right? Cerebral edema. Now, that's not the only cause of cerebral edema. Guys that go to very high altitude very quickly get cerebral edema too, swelling of the brain and such. But anyway, okay. Like everything else, there's usually many causes. Okay? Now, cerebro, C-E-R-E-B-R-O, vascular, V-A-S-C-U-L-A-R, cerebrovascular accidents, A-C-C-I-D-E-N-T-S, right? CVA, right? What's the layman's term for that?
Stroke.
Stroke, yes, okay. Strokes, right? Strokes, yes. So, the thing about strokes is, strokes are the single most common nervous system disorder and the third leading cause of death in North America. It's a bunch, folks. It's a bunch, right? Okay? Brain attacks, kind of like a heart attack, but they're brain attacks, yes? So, let's talk about the two types of strokes, okay? Number one is ischemic, I-S-C-H-E-M-I-C. Number two, hemorrhagic, H-E-M-O-R-R-H-A-G-I-C. Hemorrhagic, right? Ischemic. What does ischemia mean? Ischemia is a fancy word meaning the blood supply got cut off, right? You're not getting enough blood. Yes? Yes? You ever have an annoying kid wrap the string around your arm and start twisting it tighter, 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 and your hands start getting white? Yes? Ischemia. Okay? Ischemia. So the most common type of stroke is an ischemic. Okay? Right? Here's a blood vessel. Yes? Here's an embolus that gets caught in there. Right? And whatever in your brain is down here is not getting blood. Right? It's the same in your heart, basically. Yes? Okay? Ischemia. Right? Now, the thing about the ischemia, or the ischemic stroke, too, many times, who has strokes much more commonly? What age group?
60 to
Yes, 62.
90.
60 and up. Right? 60 and up. 60, 70, 80, 90. Why is that? Right? Because you think about it, if you have a buildup of plaque in certain arteries, yes, then it doesn't take that much for a blood clot, an embolism, right, to block it, yes? So that's why as we get older, are there young people that have strokes? Yes, right? But it's just not near as common, okay? And so ischemia, ischemic stroke. Now, the thing about an ischemic stroke is this. Emergency medicine is amazing. If you get someone that is having an ischemic stroke to the hospital within about 3 or 4 hours, preferably sooner, but within 3 or 4 hours, the first thing they're going to do is they're going to do a brain scan, maybe a CT scan, or possibly MRI, but probably CT. Anyway, and why? Because they got to know what kind of stroke they're having. But if you are having an ischemic stroke where you're not getting blood supply, they give you a medication called tissue plasminogen activator, TPA, okay? And that TPA, guess what it does? It dissolves this. And if you dissolve that clot, guess what? Blood flow is restored. And if blood flow is restored, you have a very good outcome, right? Here's the problem. Excuse me. If it's after 4 hours or so, then it's too late. They won't give it to you. It won't help. So in just a minute, we're going to talk about the signs and symptoms of stroke. But anyway, it's a big deal. True story. I had this guy call my office. Hey, would you see my uncle? Oh, okay. And he said, because he can't walk. I said, your uncle can't walk? He said, how long that been going on? I said, oh, about 3 or 4 days ago. He can't move the left side of his body and he can't walk. We'll have to carry him in there. I said, now wait a minute. About 4 days ago, he was walking, and then all of a sudden, he can't walk and he can't move the left side of his body. Yes. I said, go straight to the hospital. Take him straight to the hospital. That's not something to go to the chiropractor for. Go straight to the hospital, right? That's what I was supposed to say. But are they going to do much for him? No, he's going to be like that for the rest of his life. Why? Because it's after the 4 hours. I said, didn't you try to take him to the hospital? Oh, no, he wouldn't go. He's real stubborn. He wouldn't go. Newsflash, ladies. Men are stubborn. Men are very stubborn. Right? Yes? Okay. If they would have got him to the hospital, within about the first 3 hours, they would have done a scan and given him the medication, dissolved the clot, and he'd probably be walking around today. But instead, he's going to be laying in that bed, people taking care of him, changing his diaper for the rest of his life. Because he didn't go. How many of you have parents? Yes. Right? Grandparents that are still alive. Not me, but yes. Right? Who has strokes? Older people. Right? If you think there's a possibility they're having a stroke, you take them to the hospital, right? Unfortunately, it'll cost thousands of dollars, but they will have a very good outcome if you get them there quickly. If they're not having a stroke, they're not having a stroke. Okay? Now, let's talk about the second type, right? The second type is a hemorrhagic stroke. Hemorrhage, right? A brain bleed. Hemorrhage, H-E-M-O-R-R-A-G-E, right? Okay, you got an artery that comes up in your neck here, one here, like this. Right? Right? And this is called the circle of Willis, okay? Base of your brain, guess what? It's very common. People will have an aneurysm, right? An aneurysm is a weak spot. We can have them in any blood vessel, but it's very common to have an aneurysm. And if the blood pressure gets higher, guess what? The aneurysm will like stretch out and get bigger. And guess what can happen to the aneurysm? Boom, burst, right? And if the aneurysm bursts, then you start bleeding into your brain. That's a hemorrhagic stroke. Okay? Here's the thing. If they give you the TPA, right, and you're having an ischemic stroke, it's going to be great. You're going to have a very good outcome probably, right? But if you're having a hemorrhagic stroke, you're bleeding in your brain and they give you TPA, guess what? They're going to kill you. It's pretty important that they not do that. If you're bleeding, that would induce more bleeding. So that's why as soon as they think you're having a stroke, they do a brain scan to see what's going on. And if you are, what type? Is it ischemic or hemorrhagic, right? If it's hemorrhagic, they may be able to do a brain surgery and cauterize, stop that bleeding, right? If it's ischemic, they'll give you that drug and they will dissolve the clot. And you probably will have very little side effects, okay? So that's why it's a big deal. This is a big deal, okay? You must get them to the hospital quickly, right? Emergency medicine is where the medical guys shine, okay? You must get them to the hospital if you think that's what's going on, okay? Now, let's talk about one other situation, right? Okay? TIA, transient ischemic or ischemia or ischemic attack, a TIA, right? What is a TIA? A TIA means this, right? Transient means it comes and goes, right? Transients, they show up and then they go through town and they go somewhere else, right? They come and they go. right? That's what transient means. It's not all the time, it's transient, right? Okay? Transient ischemia, you know what ischemia means? It means lack of blood. TIA. These are very common. Let's see, yeah. They will usually last from 5 to 50 minutes, right? From 5 to 50 minutes, right? They will cause numbness, sometimes paralysis or impaired speech, right? They are not permanent, they are transient. They come and go. However, it's a red flag, right? What does a red flag mean? A red flag is a very bad sign that means you better look into this. This is not good. So someone that's having TIAs probably has some narrowing. They probably have some atherosclerosis, right? Okay. Okay. Happened to me years ago. Um, some days at my office I'm very, very busy. Some days at my office I'm slow. I'm going, I never know. I just have no idea, right? And so, for some reason, I'm having a very busy day. And I have 3 treatment rooms, and I had somebody in each room. And then I had 4 in the waiting room. Okay, it's very unusual for me to be that busy. But anyway, and so I would give the person, I'm mainly a cash practitioner, so they got to pay me, and I give them a receipt, right? So I would tell the secretary, this is the diagnosis, and she would fill it out for me and stamp it with my signature on there, right? So I'm real busy. I come out of this room, I'm in the hallway, and she's doing this. She's leaning against the wall, and she says, I need you to diagnose it. And I said, what? She said, I need you to diagnose it. Like that, right? And we were freaking busy. I mean, we're just like, you know. And I realized she's handing me the pen like this instead of her marking it, right? All it is circle, 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 right? I had like a super bill. Yes? Why is she handing it to me? Why is she talking like that? And why is she leaning against the wall? I said, are you having trouble writing? Yeah. I said, are you having trouble walking? Uh-huh. Yes. I said, do you feel bad? Do you have a headache? Yes. Right? I realize she's having a stroke. So I run to the front and I grab my cell phone and I go da 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 da, and I call her husband. Roy, get up here, get up here. You're faster than the ambulance. I think she's having a stroke. Get up here, take her to the hospital immediately. Okay? Her blood pressure was sky high. My friend Dr. Thetford took care of her, got her blood pressure down, and she went back to being normal, right? But she was having a TIA and very easily could have had a stroke, right? Okay? But I recognized the signs and symptoms in that. It was really, really odd, okay? My wife's grandmother, she lived to 93, and so they had moved her from Michigan down to San Antonio where my in-laws live. And my wife said, oh, they're having a big party, and they want me to go down, but I'm really busy. I said, no, just buy a ticket, go down and see your family. That's fine. Just buy a ticket, fly down there, No, I don't think so. I'm real busy. I got a lot of stuff going on. Yeah, well, 2 days before the birthday, she came and said my sister twisted my arm. So I told you, just buy a ticket. Just go down there. Didn't you buy a ticket? No. It was a Wednesday afternoon. So I called the secretary at the house. cancel all the appointments. I'm going to San Antonio for 4 days. I'll be back on Monday. And I was pretty pissed, too, frankly, when I told her just buy a ticket, just go down there, right? So I took her down there. My wife's grandmother had made the comment, wouldn't it be strange if I died on my 93rd birthday? Right? Yes. But she didn't die, but she stroked out on her 93rd birthday. Right? And she had a hemorrhagic stroke. Not ischemic, she had a hemorrhagic stroke. And my in-laws were there, and their other daughter and her husband, and Carolyn and Uncle Dave from Portland, Oregon, and all the grandkids were there, and the whole family was there. Was I glad I took my wife to see her family? Take your wife to see her family. It's a big deal, trust me, right? Because if she wouldn't have been there, I would have felt really bad, right? Not that it would have been my fault. But, so, she didn't die that day. They told us, though, she bled so much in her brain that even if she was a teenager, we could not do surgery and save her life. So she lingered for 5 days and then passed away, right? But anyway, hemorrhagic, right? Hemorrhagic stroke. But TIA, that means, oh crap, this is not good. You start having these, that means you're probably going to have one of these. And so the doctor is going to treat you probably with blood thinners and some heart medication and other things, okay? So it's a big deal, right? Okay? It's a red flag. Okay, now let's talk about what are the signs and symptoms of the CVA, okay? What are the signs and symptoms? Okay? Okay, sudden weakness. Write these down. Sudden weakness on one side of the face or the body. Okay, the leg or the arm, right? Sudden trouble speaking. Confusion. And it sucks when you can't read your own writing, right? Okay. Sudden loss of vision in one or both eyes, right? Visual disturbances, I should probably say. Okay. Sudden trouble walking, right? Or dizziness, right? And number 6, sudden headache, right? Sudden headache. It comes on very severe, usually, right? Most of the time when we have a headache, we know, oh, I should have ate something. Or for me, if the weather's changing and the pressure drops, I get sinus pressure, give me a headache, right? Or I had a hard day, I had a bad day, and I'm super stressed out. I mean, I pretty much know what the reason for it. But if out of the blue, boom, you got this splitting killer headache and you have no idea, right? Yes? Okay. So, I need you to write these down. Okay? Signs of a CVA. Now, you know, I enjoy kidding around a lot and giving people a hard time, especially Joseph. But anyway, right? But those are important, right? Because all of you got parents and grandparents. It's very important to know these, right? You know, I learned about geology, right? Sedentary rocks, igneous rocks, but that's not going to save anybody's life, is it? No, right? Nobody's going to live or die or have a good outcome because I know the difference between sedentary and metamorphic, right? But people could have a good outcome if I know those and I recognize what's going on, right? Get it? I'm trying to stress that. You need to know these, okay? We learn a million things in school, and most of those things we forget, right? But there are some things that are important that we need to remember for many, many years, right? Yes? We're going to study the cranial nerves in a little bit. If 2 years from now you can't remember the cranial nerves, I'm not going to be upset. But if you forget those, you don't know those, I'm not going to be happy with you. Right? Okay. Most of the time I'm not serious, but now I'm being serious. It's your family. It's a big deal. Right? Okay. All right. Sorry, I'll get off the soapbox. Yes. Here we go. TIA. Yes, ma'am.
I'm sorry, what is the last one?
I'm not telling. Sudden HA, headache.
Oh.
Right? HA, headache. Yes. If you see my notes, you'll see that a lot. Headache. Right? HA. Right? Just like shorthand. Nobody can read it. My handwriting anyway. Okay? All righty. Now, carrying right along. Yes? Let's talk about Alzheimer's. Another cheery subject. Yes? Yes? Anybody have grandparents or parents with the Alzheimer's? Yes? Yes, me too. My mom died. She started coming down with it at 80, and she died at 90, right? The last probably 2 years, she didn't know who I was and all. So real quickly, let's talk about it, right? Alzheimer's disease is a progressive degenerative. Alzheimer's is his first name is Alois or something like that. Alzheimer, Jewish doctor, Dr. Alzheimer. He's the first one who wrote about it in the literature. And there's a very famous picture of the woman that he wrote the article about, this woman that was suffering from Alzheimer's, okay? Almost half the people in nursing homes and about 5 to 15% of the population over 65. Now don't worry, I never ask you simple statistics like that, but I'm just saying, okay? Yes. Memory loss, right? Memory loss, decreased attention span, disorientation, and loss of language, right? Some people that are very good-natured, just real sweet people, when they get Alzheimer's, they become belligerent. Yes? Yes? Can you testify to that, Ms. Ritter?
Yeah.
Yes? And you know, throughout their whole life, they were the nicest, sweetest people, but when that brain goes, they can become belligerent, is a word I use. What word do you use?
Aggressive.
Oh, there you go, aggressive, right? They can, they don't want to do, yes? Okay, I had an uncle, that happened to him. He was the nicest, kindest, my old Uncle Arnold, right? He was an electrician, super guy, but when he got old, took that cane, you can't tell me what to do. He was an old bachelor, right? Never married all his life, yes? He walked around like that, smoked big cigars. My dad's name was Harold. Well, let me tell you, Harold, he was a cool guy. But anyway, he got a ticket driving down the freeway in Houston for going too slow. Honest to God, right? He was a hick from the sticks, and his pickup was from the 30s. But anyway, I wish I had that pickup nowadays. But anyway, right? Hallucinations. My mom got to where she would see spiders and spider webs on the wall coming down, right? For about 5 years, she lived part of the time with my one sister and part of the time with my other sister, right? But she knew they weren't real, thankfully, right, at the time, okay? Now, there's only one drug, I believe, Aricept, I think is the name of it. You don't have to write that down. I won't ask you the name of it. But anyway, it doesn't work very good. In fact, it's very poor to slow the progression, but we have nothing else. It's associated with tangles in the synapses. Remember, look, synapse, right? Right, another neuron there, synapse right in here. You get neurofibrillary tangles with a protein called beta amyloid. Right? This gets all clogged up. And let's see, what's the name of the other protein? Tau, T-A-U, I think. Anyway. And so what happens is you don't get that nerve impulse, that action potential going from this nerve to this nerve like that. Alright? Yes? Now, oh, by the way, remember? We talked about the glial cells and the microglia. And when you sleep at night, what do the microglia do? Help to clean the brain and get rid of that beta amyloid, by the way. Is that the cause of the disease? Very controversial, because they came up with some drugs that helped to get rid of that, and their symptoms didn't improve. So some people, the latest thinking is that that's a response to the disease, that it's not the cause of the disease, see? So it's very interesting because we just flat don't know, okay? Neurofibrillary tangles, that's what they are. There are some people that have a genetic predisposition for it. They have a gene called APOE4, I think. If you carry that gene, that does not mean you're going to get Alzheimer's. It means you have a predisposition for it, right? Okay. My father had a heart attack at 50. He was a skinny man like me. Did I have a heart attack at 50? No. He smoked those cigarettes, right? Yes. Okay. If I would have smoked the cigarettes, I could have done the same thing too, probably, right? Yes. A lot of your health has to do with your lifestyle. But anyway, that's another subject, okay? Okay. Now, couple of things. What do you do to prevent Alzheimer's? Because that's what the thing to do. What do you do to prevent Alzheimer's? Okay. One at a time. Ms. Crawford. Okay. No, that's not correct. Diet? Yes.
Memory exercises.
Memory exercises? Okay. Yes. Right. See, they did a study. Well, number one, let's talk about this. When we're young, we make all these synapses in our brain, right? We make all these synapses because when we're young, we don't know anything and we're learning everything, right? And guess what? People that have higher education have much less Alzheimer's disease. Why would that be? Pardon me?
There's more synapses.
Bingo. Because when you get higher education and you learn and you make more connections in those brain, so maybe this synapse right here gets clogged up, but guess what? There's another one over here, right? If we're driving down 7th Street, right, and when you get along, and say we're driving down 7th Street, right, and there's a car wreck, somebody got rear-ended and they stopped traffic, what do? We cut over to 6th Street, or we go the other way to 8th Street, and we go right past it and around it, right? Because we live here and we know how to get around it. Yes? In the same way, if you have more synapses in your brain, right, then even if you have that in your brain, you're much less likely to have signs and symptoms. And one of the ways to make more synapses is to have higher education, right? And the more education, the more degrees, the longer you went to school, the better for your brain. But anyway, I'm just saying, right? Now, for some reason, ladies have Alzheimer's more than men do, for some reason, okay? I can't tell you why. I do not know. My dad lived to 75 and his brain was great. And my mom at 80 started going into it and such. Okay? Now, the next thing you do, exercise, aerobic exercise, walking, riding your bike, swimming, jogging, all of that, right? When you do that, you stimulate a chemical in your brain called brain-derived neurotrophic factor, BDNF. Okay? brain-derived neurotrophic factor, BDNF, right? And that neurotrophic factor stimulates your brain. Okay, it's very good for your brain, and you get that by aerobic exercise. Okay, I would guess probably from resistance too, lifting weights also, but especially we know from aerobic exercise. Okay, now they did a big study on a bunch of nuns, pardon me, and one of the things about the nuns was that very few of them developed Alzheimer's, right? But these nuns were always reading books. These nuns were always studying different things. These nuns were always having discussions about different topics, you see. And so they had a lifestyle, or part of their lifestyle was what she said, exercising their brain, right? Yes. And so they were much less likely to develop the Alzheimer's, or if they did, at a much later, right? So even if you develop it at 90 instead of 80, that's way good, right? Yes? You push it back several years, okay? Oh, by the way, ladies, if you even think you're going to get pregnant, or you're trying to get pregnant, right? You eat a lot of eggs. Because certain studies have shown if mom ate a lot of eggs, guess what? Her baby is much less likely to have Alzheimer's disease. Okay? So if you're even thinking about it, or you get pregnant, you eat a bunch of eggs, ladies, right? Eggs are brain food. They're very good for you, right? They're very high quality protein. And as far as protein goes, we get protein from meat, right? And meat's expensive compared to a sack of potatoes, right? 10 pounds of potatoes, you only get half a pound of meat for that, or anyway. Okay? So, having more synapses, that's called cognitive reserve, right? Cognitive reserve, that's what that's called when you have a bunch more synapses in your brain. Yes? Okay? Now, here's another thing. I won't go off on a long lecture on that, but we talked about nerves. Neurons got to have their oxygen and their nutrition in the form of glucose. Okay, but here's the thing: people that run high blood sugar for long periods of times become insulin resistant. Okay, insulin resistance is where we our body does not respond to insulin like it used to, and it takes more and more and more insulin, okay? And in time, our cells become insulin resistant, yes? Now, normally, I eat something that's sugary, insulin comes on, it secretes. The insulin opens the key to put that sugar out of the blood and into the cells, right? But when there's sugar, and insulin, those cells become insulin resistant. It's very common. They estimate like 3/4 of the adult population are insulin resistant. Okay? This is the way I like to explain it, right? The little guy that lived next door's name was Greg. And during the summer, Greg would knock on the door. Can Will and Dave play? Right? Only he got to where he would knock on the door 5 or 6 times a day, right? Well, after a period of that, what happened? Did I open the front door? I looked out the window and I saw, oh, that's Greg. I'm not opening the door, right? Because I know what he wants. Yes? Yes? In the same way, those cells, sugar, insulin, right? And it takes more and more insulin to have it to be effective, okay? And so when that happens, we become insulin resistant and such. So the pancreas has to make more and more and more insulin. And eventually the insulin, the beta cells, burn out and don't produce enough. Guess what happens? What's the name of the disease? What kind? Type 2. Type 2 diabetes. Those beta cells can't produce enough insulin. Here's another thing I need to explain to you that everybody ought to know that most people don't, and this is really sad. Okay? I was taught 80 to 120 is normal blood sugar, right? Preferably in the lower range, but then if you eat something, it'll go higher and come back down when insulin comes on, right? Yes? So if you wear a continuous glucose monitor, maybe the insulin will do this, right? Yes, but it will stay in the normal range, yes? Okay, here's the thing. Once a year, people go to the doctor and they get their annual physical and they check their blood sugar. And you fast, don't eat anything after midnight. And the next morning, they take your blood sugar and they say, oh, your blood sugar is 100. Well, 100 is considered pre-diabetic if you've been fasting. But they say, oh, you're just on the start, right? And pre-diabetes can last 10 or 15 years, right? So your blood sugar is in the normal range. But what they don't check is, guess what? To keep that blood sugar there, insulin climbs over the years. Insulin does very good to keep your blood sugar down. You may be insulin resistant for 10 to 15 years. Your insulin levels are getting higher, 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 but your blood sugar is staying normal. And what happens is eventually the beta cells burn out and the insulin levels go like this. And when that happens, guess what happens to your blood sugar? And when this crosses, guess what you got? Type 2 diabetes, right? But the doctors check it one time a year. Oh yeah, your blood sugar is 100, great. You're in the normal range, right? Almost never do they check the HOMA IR, right? So if your blood sugar is normal, but if your insulin is super high, guess what? You're insulin resistant because your pancreas is cranking it out, cranking it out, cranking it out to keep your blood sugar down. But after 10 or 15 years, guess what? It can no longer do it anymore, right? And the insulin levels drop. And as soon as insulin levels drop, what happens? Boom, and you got type 2 diabetes. We'll talk a lot about type 1 too, right? Type 2 diabetes. What are the three things that go with, or the two other things that go with type 2? Type 2 diabetes, kidney failure, heart disease, right? All three of those go together, don't they? All three of those go together, right? Yes? Three cords tied together, one big strong rope, yes? Some believe, and I'm a believer, that it relates to the insulin resistance, right? All three diseases. Oh, by the way, that brain that's got to have that sugar, but it becomes insulin resistant, and the brain's not getting fed. So if they switch over to a low-carb diet, guess what you produce? Ketones. The most prolific is beta-hydroxybutyrate, and what does that do? Feed your brain. Your brain runs very good on beta-hydroxybutyrate, right? Yes? Ketogenic diet, by the way. And I'm not ketogenic. I'm low carb, but I'm not ketogenic. I don't need that, right? But anyway, so you don't want insulin resistance. What's the cause of insulin resistance? We don't know. Did you gain a bunch of weight because you're insulin resistant, or did you gain a bunch of weight and then you got insulin resistance? Chicken or the egg? We don't know. But anyway, Alzheimer's, dementia, heart disease, kidney disease, they're all related. They're all related. Some doctors believe that is the root of it. Okay? Right? Dr. Jason Fung, kidney specialist, right? He said, I got so fed up with treating these type 2 diabetics, and they got sicker, and I gave them more medicine. They got sicker, and I gave them more medicine. They got sicker, and I gave them more medicine, and they died. This is what he said. Anyway, so he treats them now with the diet and fasting, right? Low carb diet, fasting. When you fast, guess what you do? When you fast, you rest your pancreas, right? And your cells become less insulin resistant. That's the word I'm trying to say. But anyway, I don't mean to go off on that, but this bugs me that we know this, and all we do is check, oh, you're normal, 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 and they may tell a patient that for 15 years, you're normal, and then the next 6 months later, kaboom, that's when oh, sorry, you developed type 2, right? Or little by little it creeps up, yes? So, but anyway, astounding. That's going to change over the next 15 years. That's going to change. They're going to start teaching the medical doctors that. I have total confidence that's what's going to happen. They're going to start teaching them. But it's a shame it's going to take a long time. Because what happens is all the old doctors have to die and all the young ones with the new training have to come up. That's what's going to happen. But anyway, okay? Sorry. Okay, Parkinson's disease, right? Usually in the 50s to the 60s, Parkinson's disease, right? Okay. Up in your brain there, close to the thalamus, you have the, it's called basal ganglion. And part of that is called the substantia nigra. Nigra for negro, black, right? The black nucleus, and it secretes dopamine. And dopamine is responsible for a lot of inhibition, right? And when you don't have enough dopamine, you don't have enough inhibition, and you get the rolling tremor, right? We talked about that, yes. And oh, by the way, in certain other areas, right? The Parkinson's, the guy's face, not very much expression, yes. And his movements are very slow. And oh, by the way, he has a shuffling gait, kind of leans forward and he kind of walks like this. And to initiate movement, he's very slow, right? Mr. Howard, a fencing master. You know what was astounding to me was the guy would give me lessons, saber lessons. He was an old saber fencer, you know, and here he would be shaking, and he would say, allez, meaning go, right? And then he'd go do this, pow, 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 and beat the crap out of you, man. You're like, right? It's like almost 80 years old and such. But then as soon as he stopped, he was right-handed. He's shaking again, right? But when he had intention to it, when he was doing, I'm telling you, it was amazing. The guy, he's like shaking, then he beats the stuffings out of you. Not the little kids, just I was an adult, the big kids like me. Anyway, really, yeah. Okay, the treatment, right? First thing they do is they give you L-Dopa. L-Dopa, right? Yes, right? That's the most common treatment. And then in time that doesn't work. And sometimes they will put brain stimulators in, okay, deep brain stimulators. And two, sometimes they do stem cell transplants. And I do not know if that works really good. Do stem cell transplants work? Okay, yes. Let me explain. When that first came out, Muhammad Ali, he went to Mexico. And they took fetal cells and implanted them in his brain. And he started growing hair in his brain. And it didn't work a lick, right? But do stem cell treatments work? For certain things, they work very well. But you need to take stem cells out of me and put them back in me in a different spot. If you give me my stem cells, there's no rejection, right? And there's a much, much higher probability. There's never, ever, ever been a successful treatment, to my knowledge, where they took aborted babies and their stem cells and put them in someone else and they had a good result. Because rejection, right? Yes? But yes, stem cell treatments. Yeah, some people it works. Some people it really does. And remember, a stem cell can turn into any different type of cell. But anyway, okay? All right. There are a few people that get Parkinson's young. If you know who Michael J. Fox is. Michael J. Fox, Back to the Future, that guy. He's almost the same age I am, very close. And he's like this, right? He's got it bad. Bless his heart. Yes, and he's my age. So anyway, yes. But anyway, sometimes I treated a guy years ago, and I still treat his wife occasionally. He was in his 50s, developed it really bad, and it's sad. Okay? Huntington's disease, Huntington's chorea, astounding. Astounding. I had a guy in my office today that said, "Oh, I have Huntington's." I said, "You have Huntington's chorea?" "Yes." He told me that today. I never knew that. I'd met the guy before. Huntington's chorea. Chorea is the Greek word for dance. People with Huntington's chorea start doing this. They can't control their movements, right? And such. Okay? And usually within 15 years, you're dead. Okay? And it's a genetic. Oh, by the way, have you ever heard of Mutiny on the Bounty, the movie? Right? Captain Bligh and all that stuff. And they took over the ship. And they sailed the ship. And it's a true story to Pitcairn Island. And those sailors lived there on Pitcairn Island. And they married the local gals. And one of those guys, guess what? He had Huntington's disease and passed it down. And now, a lot of people from that area, they have studied them. And they're all related to the one British sailor that had that. And so they've learned a lot about the disease because that one guy. Yes? And such. So it's really fascinating. But it's Pitcairn Island. I'd love to go there. It's in the middle of nowhere island. But anyway. Okay? So, next question. He said my brothers have it, and I can't remember if he said my grandparent, one of my grandparents had it, but anyway. Next question. You can do genetic testing. Do you want to find out? Do you go and find out if you have the genes for it? Or no, I don't want to know. I'm just going to live my life and I'm not going to want to know. What do you think? Do you just enjoy life and don't worry about it? Or do you go find out and possibly find out, oh, by the way, I carry the gene for this, so I'll probably develop it. And once I get it, I'll probably live 10 or 15 years and not in good health. Anyway, there's no right answer. It's what you think, right? It's what you think. But anyway, okay? Okay, all right. Let's get off these diseases and talk about the spinal cord, okay? The spinal cord, yes? Well, I'm glad we did a bunch of this yesterday because it's a freaking long chapter. It's a really long chapter, right? The spinal cord, right? The spinal cord is, of course, between the bones, right? And the dura. The dura wraps around it, yes, okay. The space is filled with soft padding of fat and a network of veins, right? The dura, D-U-R-A, right? The dura, we talked about that, dura mater, arachnoid, pia mater, goes down to S2, right? That is, here's your first sacral segment, there's your second sacral segment right there, right? That's what I mean when I say S2, sacrum, sacral segment number 2, okay? Now, but the spinal cord goes down to L1 or L2, right? L1 or L2 is 5, 4, 3, 2. 1, 2. Spinal cord ends about here and such. So, oh, by the way, when they do a spinal tap, what do? They bend you forward and they stick the needle usually above, right above L5, or possibly below L5 above S1, right in there, right? You're sitting like this. I hate that. It's a wonderful skeleton. It's a tremendous skeleton. I love the skeleton. That is I can't say what kind of a rack that is, but anyway, it's very irritating. I want to hang something from the ceiling so he'll just hang there, right? Mm-hmm. Yes, but anyway. Yeah. Sorry. It's irritating. Anyway. Again, when they do the spinal tap, you bend forward. The needle literally is about 4.5 inches long, and they stick it straight in there. Right? Yeah. Oh, by the way, can you say epidural? Yes. Right? Yes. Now, when they're doing a spinal tap, they take some fluid out and they analyze the fluid under the microscope. And they're looking for pus and they're looking for germs, right? Viruses, bacteria, yes, and such. And so when they're doing an epidural, then they're shooting medication in there to kill your pain, right? Yes? Okay, spinal cord, right? The end of the spinal cord looks like this, right? And that is called the conus medullaris, right? The little one right down here is called the phylum terminale, right? And collectively, this is called the cauda equina, Q-U-I-N-A. What does cauda equina mean? Somebody tell me, please. If you get a degree in equine studies, what did you study? Horses, right? So the cauda equina means the tail of the horse, because the way these little nerves come out like that, it looks like the tail of a horse. Yes? Right? The reason I mention that is this. That you know, chiropractors, we don't get sued for malpractice very often. It's actually pretty rare, right? But one of the things that can happen is if you blow a disc and it's pushing on nerves down there, and you lose bladder and bowel functions, right? It's very serious. That's called cauda equina syndrome, okay? Now, in my 36-year career, I've seen that 3 times. And when I see that, I send them straight to Amarillo. Nothing against the hospital here, but there's no neurologist here. They need surgery. They need surgery immediately. If they get that pressure taken off of those nerves, then they'll probably regain their bladder function and their bowel function. If it's not taken off quickly, then what happens is they're wearing a diaper for the rest of their life and you're getting sued, right? So that is a big red flag, right? I always ask when they come in, do you have any trouble going to the bathroom? You can be okay, go to the bathroom? Yeah, okay, gotcha, yeah. If one lady said, no, I haven't peed in 24 hours. I said, okay, go straight, get in the car, go straight to Amarillo, tell them that. Go straight to Amarillo right now. That's not normal. You need to go to the ER. Don't go to your doctor. Go to the ER in Amarillo and tell them what's going on. You're having the back pain. It hurts down your leg. You can't go pee. Go immediately. So if I do that, I don't get sued. There's no problem because I did the right thing, because that's a surgical emergency. Like I said, 36 years. I've seen it 3 times. Thankfully, I recognized it each time and sent them on, and there was no problem, right? But if I screw up and I didn't know that, right? If I was incompetent, then guess what? Right? I could lose everything. It's a bad deal. See, people don't understand. When you pay the doctor, you're paying for his expertise, and you're also paying for his responsibility, because he's responsible. And if something bad happens, he's in big trouble, right? Yes? For chiropractors, the main thing we do is break someone's rib, right? Yes? If you're going to be a chiropractor 40 years, you're probably going to break some ribs, right? The average is about 3. I've already broke my 3, but anyway, yeah. So, and they were all very nice about it, so I'm so sorry, right? And I get sued, but I could have. Yes? It's one of those 1 in a million things. It can happen, right? Now, they hurt for 6 weeks, and then it heals up, and they're fine after that, right? Okay? But, anyway, I haven't had, and the other one is the cauda equina syndrome. It's a big deal, okay? Anyway, okay. Now, spinal cord, ligaments that hold it, right? Ligaments that hold it, right, are called dentate. D-E-N-T-A-T-E, like dentine gum, dentate ligaments. Okay? Okay, now let's talk about what the spinal cord looks like. If we slice through the spinal cord transversely, it looks like this, right? Oh, by the way, remember we talked about when you're the neural tube develops immediately when you're an embryo, right? Guess what? It's still there. That central canal, CSF floating through it, right? It's still there. That neural tube, remember in the top of the neural tube, your brain grows from it? Yes? Bingo, it's still there. But anyway, okay? Now, if you look at it, and it looks like this. Could somebody shut that door for me, please? Okay? That's pretty much what it looks like. This is anterior. This is posterior. Right? There's a fissure back here and a fissure up here, by the way. Okay? This is called the ventral horn. This is called the dorsal horn. Dorsal or posterior horn. And this one right here is called the lateral horn. Yes? This is more gray matter. Okay? And this around here is the more white matter. Okay? Yes? This looks like a butterfly. Now, I could also draw it like this. And that would also be correct. Yes? But let me explain. What's the difference? This looks like a butterfly. This doesn't. This has this here, right? What's the difference? The difference is this, right? This is cervical or lower lumbar. And this is thoracic. Okay? This is thoracic. Think about it. What do you have in your thoracic, in your thorax? What do you have from here to here? You got a bunch of guts, right? Yes? Okay. So, this lateral horn, yeah, that's to your guts, folks, right? That's why it's there. So if you see this, you know, okay, it's up here in the neck or it's down low. But if you see this, you know, through here or upper lumbar, right? Okay? Now, what happens is, okay, is that, you remember on the pigs when we did the dissection and we looked for the spinal nerves. And the spinal nerve this is a simplification, but anyway, the spinal nerve looks like that. Okay? Right? We saw the little spinal nerve sticking out from the spinal cord, right? That's them. Okay? Back here, coming into here, guess what that is? Sensory. Up here in the ventral horn to there to here, guess what that is? Motor. Good guess. Motor. Right? Yes? Right? So the sensory nerves come in the back. Remember sensory afferent, motor efferent, right? The signal comes in, up to the brain, decide what to do, comes down, motor, right? Okay? Remember too on the brain we had the two stripes, primary motor cortex up front, primary sensory in the back. I love it when stuff makes sense. You know what I'm saying? I love it when stuff makes sense. Yes? Okay? So, let's see, where else are we going? Where else am I going with that? Yes? Okay? Sensory and motor, right? Now, the epidural space is filled with soft padding and fat around the spinal cord, right? Spinal cord ends at L1, L2. Make sure you get that. Spinal cord, L1, L2. Dura, about S2, okay? Okay, this around here is more the white matter. Yes. Remember the white matter is probably has myelin, that's why it's whiter, yes. And it's coming from up above down, most of the tracks there, right? And remember, a nerve in the spinal cord, we call it tract, and when it leaves the spinal cord, we call it a nerve, right? Okay? Okay, let's talk about some words here, right? Functional loss, paralysis, P-A-R-A-L-Y-S-I-S, paralysis, right? Paralysis is loss of motor function, right? Loss of motor function, yes, paralysis. Now, another word, paresthesia, P-A-R-E-S-T-H-E-S-I-A, paresthesia. Paresthesia means altered sensation. Maybe something feels numb, right? Or maybe it feels a little tingly or unusual, right? Paresthesia, okay? Now, let's talk a little bit about spinal cord injuries, all right? Spinal cord injuries, yes? These nerves, these spinal nerves that come out, there are 31 pairs, and we number them. The one on top of the atlas is C1. The one under that atlas is C2, etc. Goes down to C8, then T12 and such. Okay? So what happens is that, the reason I mention that is this. If you have a spinal cord injury and your spinal cord is transected, it's damaged all the way across, you will get paralysis. Yes. Some people get paralysis from, say, here down, right? Some people are, what's that? When all four of the limbs? Quadriplegia. Quadriplegia. Why in the heck is that?
4 limbs.
Pardon me?
The 4 limbs.
Right, but why do they get quadriplegia? The reason they get quadriplegia is this. It depends on where in the spinal cord is damaged, okay? From C1 to C8, right? C meaning cervical, right? Your neck is your cervical spine. C1 to C8. And the lower part, C4, 5, 6, 7, and C8, that's called brachial plexus. Those nerves that come out in the lower part of your neck, under the armpit, control all of the arm, right? And when you get into the thoracic spine, it's called T1, T2, T3, like that, as such. So if your spinal cord is damaged from C1 to C8, right, up high, guess what? Your arms and your legs. So you're going to be a quadriplegic, quad, right? Now, from T1 down, you're going to be a paraplegic. A paraplegic meaning only your lower limbs are going to be involved, right? Yes. Yes, I supported the Paralyzed Veterans of America, but anyway, many years, right? But think about it. I treated a boy when I was in college. I shouldn't say that. I treated a young fellow when I was in college, and he was 17 years old, and he dove off the railroad bridge. And guess what he did? Hit head first in the shallow water, and he fractured along about T8, and he was paralyzed from here down. And his upper body was kind of muscular, right? But from here down, right? Limp. Yes? Okay? Why? Why was he a paraplegic? Because his injury was about T8, and from T1 down, you're going to be para. Now it's up in your neck, C1 to C8, you're going to be a quadriplegic. You're going to lay there, pretty much. Okay? And that's the difference where the damage is. Is the damage up here, or is the damage down here? Right? And that is the difference. Yes? Now, I want to say one more term too, hemiplegia. H-E-M-I-P-L-E-G-I-A. Hemiplegia. Hemi means half. Okay? Okay? hemiplegia, usually what happens is you have a stroke up here and affects the other side of your body. If it's over here, right? Remember contralateral? Contralateral for the cerebrum, yes. Cerebrum, not cerebellum. Cerebrum, yes. Cerebral hemispheres. Contralateral, opposite side. So if you have a stroke over here, right, that probably means you had a stroke, right? If you have hemiplegia, probably, because it's the whole side and it's such, right? Okay. By the way, if you have a stroke up here, that's upper motor neuron, and you're going to be spastic, right? And maybe the hand will go like that. It'd be really tight. Those muscles will be spastic spasm, right? And if it's down in the spinal cord, it'll be flaccid. It'll be cafeteria lady, right? Yes? It'll be flaccid. It'll be weak. It'll be wobbling. Yes? That's called lower motor neuron. But anyway, okay? Okay. Now, who has injuries like that transect the spinal cord? Can be a motorcycle wreck, but more commonly, who? Okay,
Football
no.
players?
Huh?
Football players?
Thank you. Football players, right? Football players, right? They hit their head. Sometimes their head is cranked way back. And they injure their spinal cord. Sometimes the head is forced forward into there. Okay? Now, whenever that happens, they're going to put you on a backboard and they're going to log roll you, right? Your neck is tied where it won't move, and they're going to roll you over on your back, and they're going to take you to the hospital and figure out where the damage is. And they may put you in a drug-induced coma, and they're going to give you very high doses of steroids, which are anti-inflammatory, right, to try and limit the swelling of the spinal cord to preserve function. So for about 48 hours, you'll have spinal shock. And that's when you better hope that your wife is calling the prayer chain, because you got about 48 hours and you may come out of it. And after 48 hours, if you're not moving your toes or feeling your toes, then it's probably going to be permanent. But for about 48 hours, you have what's called spinal shock, and sometimes the medication will get the swelling down, and you'll come out of it, and you will not be a paraplegic or quadriplegic. Okay? It's very critical, that first 48 hours after they take you off the football field. And it's not only that, but that's the most common I've seen. Okay? Yeah, was a famous motorcycle racer that wrecked and paraplegic and such. And after that, this was years ago, and what happened was they had hay bales around, and he went slamming into the hay bales. If you watch like MotoGP now, do they have hay bales? No. What do they have? On the edge of the track, they have sand and gravel. And you see these guys, they go flying off the track, and they go bouncing around like a rag doll and this and that, but they don't slam into anything. And oh, by the way, they have airbags on when they come off, and the airbag blows up. And many times, what do? They jump up and they run over there and they grab their motorcycle. So now, any MotoGP like that, when you're going flying through the air, you're dissipating energy every time you hit the ground, and they're injured much less than if they slammed into a hay bale or something, right? Yes. But anyway, interesting. Yeah. Okay. And I think that guy became a sportscaster talking about motorcycle racing. He's very famous. But anyway, right? Now, okay, poliomyelitis, right? Or most of the time we just say polio. Okay? Don't shout this out if you know it, Joseph. Who was our president? Who was our famous president that had polio, by the way? Somebody tell me.
Is it FDR?
FDR, right? FDR stood for
Franklin Delano Roosevelt.
Franklin Delano Roosevelt, right? There's only one piece of film of FDR walking. He wore heavy braces on his legs. And back then the press was not vicious. And they thought if you showed the president walking, because he had heavy braces and his son was always beside him, and he would always hang on to his son. His son would hold his forearm real rigid. He was hanging on to his son, and he walked like this with those braces. There's only one film of that. It's about 8 or 10 seconds. It's the only film that exists of FDR ever walking. You almost always see him. He's in the big fancy convertible car with a big smile and the lovely Panama waving at people, right? You never see him that. They didn't want to show the president as weak, right? Now the press would shred you, but anyway, back then they were much more respectful, right? So, polio, we said this is the posterior horn, this is sensory, this is motor, right? These motor cells in the front here, guess what? Those are the ones affected by polio, right? How is polio spread? Fecal oral. What does that mean? People not washing their hands after going to the bathroom, right? Yes? Now, they give immunizations for polio now. They give two kinds. One is Salk and the other is Sabin, and I can't remember which is which, so forgive me. But anyway, one of them is a dead vaccine, and if you get the dead vaccine, you can't pass it on. If you get the live, it's said to be attenuated. Attenuated means it's much weaker, okay? You can pass it, right? In certain areas of the world, they still give the live vaccine, more Africa than here. Oh, by the way, they around the world still check the sewage. And guess where they've discovered it? Polio in London, certain areas of London. And some of the people who live there are from Africa, right? Where they give the live polio. Yes. Wash your hands, ladies, when you change the diaper. Wash your hands. Right? But anyway, okay? So they're monitoring that situation now. Dr. John Campbell, he's a genius. You should watch him. He's a PhD nurse guy. He's an old British dude and such. And anyway, I was watching one of his videos a couple of days ago. I mean, this is recent. This is within the last couple of weeks they've discovered that. He's like, I'm not too worried about it because we think it came from Africa. The people who live in that neighborhood are from Africa. But that polio is showing up in the sewer water. Right? Anyway, yes. Right? Polio, fever, headache, muscle pain, and weakness. Right? Fever, headache, muscle pain, and weakness. Yes? By the way, when people have had polio when they're young, many times when they are much older, in their 60s and 70s, they get post-polio syndrome. They get a lot of pain, they get a lot of burning in their muscles, and the muscles will atrophy and weaken. So post-polio syndrome, that comes back years later. Okay? Now, let's talk about ALS quickly. Amyotrophic lateral sclerosis. Yes. Okay. ALS, right? Lou Gehrig's, Gehrigh, I believe it's pronounced. Lou Gehrig's disease. Right? Who is Lou Gehrig? Lou Gehrig was a very, very, very famous, tremendous baseball player. And then World War II broke out. And World War II broke out, and guess what Lou Gehrig did? Back then, sports people, sports heroes, and the movie stars and all, they loved America. And so he signed up for the Army. He was in the Army for several years. And then after World War II, he went back to playing baseball. And he was a tremendous hitter. And what happened was that he started to lose it. He started to lose his muscle tone. And he developed this ALS. ALS affects, guess what? Right? The same with polio. These motor cells in the ventral horn. Okay? There are genetic factors. Some people have a genetic tendency for this, and there are also environmental factors for developing this. Now, who is the most famous one that you folks have heard about that has ALS now? In fact, I think he just died just recently. And he wrote a bunch of books. And he was a very famous brainiac. He proved a famous equation with his friend Roger Penrose. And they always showed him in the wheelchair like this. And his voice. Hawking. What's his first name? Stephen Hawking, right? Stephen Hawking. ALS, right? That's the one you guys would know about. Yes? Right? But anyway, very interesting. Stephen Hawking, yes. He was the one that you guys, I figured, would know ALS, right? I had a very interesting patient, and she complained of weakness, and she complained of all kinds of. When you treat people, there are different types of patients, and there are some people that are very matter of fact. Yes, this is my trouble, da da da, blah blah blah. Then there are other people that are unique. Let's just put it that way, okay? I know one of my friends that's a chiropractor. He was treating this lady, and she was unhappy with him, and he said, I tell you what, why don't you write down all of the symptoms that you have, so that way I'll have it written down, so I will know, you know. And she said, okay, I'll bring it to you the next time I come. And so the next time she came, right, she gave him the list of symptoms. Yes? It was 3 pages long. No, I'm serious. It was 3 pages long, right? He said she wrote on there her toenails hurt. 8. Okay? No, I'm serious. So you have some patients like that are, anyway, tough. And so, I must admit, I had kind of put this lady in that category that she had some very unusual complaints. But I knew she was going to a neurologist too, and I'm like, okay, good. Go to your neurologist, he'll figure that out and this and that. But I thought no, she had the ALS too, and she died several years later. And I saw her husband a year or 2 after she died, and he told me, oh yeah, that's what she had. She had ALS. You know, she was taking some weird treatments. She was taking some very strange treatments that I was not familiar with and such. But anyway, okay? So you never know is what I'm saying, right? You never know. You can't judge a book by its cover. But I've had hundreds of patients like that were. Okay? Now, let's talk about, shall we go over these? Yes? Two, if you were not here the first day and you got one of these sheets, the ones you have to know are the ones that are circled, not the ones that are not circled. I don't know if you got that. Okay? Okay? Let me see if I can find mine. All right? Okay, there's one there. Great. Thank you. Super. Okay. Right? these skinny muscles right here. Oh, this part of my head were called the temples. So that's the temporalis, right? The ones here. So I can masseter. So I can masticate, right? Masticate. Don't be thinking what you're thinking. Masticate, right? Mastication means chewing, right? Yes? Yes? Okay. The big trapezius shaped one is called the trapezoid, I should say. Trapezius, right? Trapezius. Yes? Okay. You got three. You got an anterior, a middle, and a posterior deltoid. Here, 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 right? Anterior, middle, and posterior deltoids. Yes? This is your biceps brachii. Brachii meaning arm. This is tricep. 1, 2, 3 heads, 2 heads, right? Okay? Yes. Now, the front of the leg, I'm going to be real easy and just say quadriceps, right? Your quads, quadriceps, right? Now, the circular muscle around your eye and in your mouth, right? Orbicularis, oculi. Oh, by the way, you look through that, what on your microscope? Ocular, right? And oris, right? Your mouth, okay? Now, across here, from the mastoid to the clinoid to the sternum. Sternocleidomastoid, SCM, sternocleidomastoid, right? Helps us to move our head sideways, but also rotate the head, right? SCM. Okay? Okay. Your pec major, and underneath it, pec minor, yes. In between the ribs, this is the costal cartilage, and in between here you have the intercostals, right? Intercostals, yes. Okay. Down the middle, your six pack is your rectus abdominis, and the muscles that come across, right? External and internal obliques. Oblique meaning going from here over to here. From here over to here. They don't go in a straight line, they go in a diagonal. They're oblique. Yes? Okay. Up here, tensor fascia lata, TFL, right? TFL. Yes? Okay? Now, front of the leg, when these get irritated, you get the shin splints, and that's, say it again, tibialis, right? This is the tibia. This bone is the tibia, right? The tibia, right? Tibialis anterior, right? The front of the tibia, yes? Helps you to raise your big toe up, right? One of the exercises for shin splints, you'll sit there and do this with your feet up and down. What does that do? It strengthens this muscle, anterior tibialis, right? This is one of the things it does. Okay? Right? Now, it has gastroc and soleus on the front, but it's much easier to see those on the back, right? Okay? On the back, you can see the trapezius, the deltoids, the triceps brachii, right? Triceps, 3 heads, and the rhomboids. Rhomboids, yes. Pull those shoulder blades together, rhomboids, right? They're called rhomboid because a square like that is called a rhombus, right? Okay? Rhomboids, yes. Now, the big muscles coming across and attach here.
Lat.
The lats, latissimus dorsi. You got to have those for pull-ups, right? Latissimus dorsi, right? Gluteus maximus and medius and minimus, right? Gluteal region, gluteus. Okay? Again, the back of the leg, 4 muscles, but we'll just say hamstrings, right? And again, gastrocnemius, right? Your medial head and your lateral head, gastrocnemius, right? Your calf muscles and your what tendon? No, the tendon. Achilles tendon. What's the story from Greek literature?
He was dipped in a river. They didn't swell except they had to hold him up by his Achilles. That's why he's going.
Okay, all right, I heard it a little different, but anyway, yes, Achilles, okay? And underneath those two gastrocs, you have another flat muscle, and that is your soleus, right? Soleus. So when you stretch with your legs straight, and then you bend your knee and you stretch some more with the knee bent to take the gastrocs out of it, right? The soleus, yes? Okay? Okay. All righty. Any questions about these? No? Okay. Of course, we will not have the class of 4. So I will see you on Tuesday. Have a great weekend. And work on your project because the project is going to be due right after that. So even though you have 4 days off from school, you have to work on your project. Make it good. Make a good grade.
I don't want to use Snapchat with these.
Hold on, I don't think I have Snapchat on my phone. I don't use it.
I think.
Yes, ma'am.
Where's easiest for you?
What's like fitness? Yeah. Is it gonna be like?
It could be we have an odd number. Yeah, that's 3 is fine. 3 is fine. If it doesn't, if everybody else is signed up and you have another one, then you can just do the 2 of you. But, I would prefer to do 3 or 4, but, it's not concrete, it's just not like that. It's all things to try to work together. Yep.
I
Okay.
do have it.
Teamwork. Teach teamwork.
Should I go
Yes.
ask Peyton real quick? Yeah, go ask.